Well, HIV was once considered a death sentence, but now doctors are saying it's as manageable as diabetes and other health conditions.
KSNT News reporter Willis Scott tells us how a Topeka organization is making strides in treating the virus.
Positive Connections Executive Director Debbie Guilbault says in the 80s, people's HIV often developed into AIDS.
Initially, people were dying pretty much within weeks of diagnosis.
Scientists developed medications to keep HIV from progressing to AIDS. At first, people had to take several pills several times a day. Dr. Sidhi Mankami at Stormont Vail says in the last decade, those medications have been combined into single pills.
It's gotten down to being as easy as taking one pill once a day.
She says that means more people are taking their medications to manage the virus, to the point where a person who has HIV can even safely have children.
They don't necessarily pass it to their partners and not to their babies either.
In the past year, Debbie Guilbault says they've started telling their clients about PrEP, a medication that helps protect people from contracting HIV.
It is designed to taken every day to reduce the risk of HIV infection for people who are at higher risk.
In 2018, they also sped up the process for getting underinsured people with HIV into treatment. It once took more than a month to get those patients federal assistance paying for treatment. Now it only takes about 10 days.
It's not same-day treatment, obviously, but it's a lot quicker than waiting 6 to 8 weeks before you can get in to see the doctors.
Dr. Mankami says the advancements in treatment make HIV like many other health conditions.
Like diabetes, high blood pressure, high cholesterol. As long as you take your medication, your disease is controlled. That's how far we've gotten.
The most recent numbers from the Centers for Disease Control say HIV infection rates fell by 8% from 2010 to 2015. At the end of 2015, about 1 million Americans had HIV. Willis Scott, KSNT News.